Holyoke Works and Holyoke Community College have partnered to facilitate a 15-week home health aide and CNA program for people whose primary language is not English. Many of the program participants were nurses and doctors in their home countries, but because of language barriers and different licensure requirements, they cannot continue their practice in medicine in this country. But as producer Alejandro Cameron shows us, this program helps them enter the field again at the ground level.
This is a program to provide adult immigrants an opportunity to learn English and also at the same time learn skills to become a certified nurse's aide and home health aide. And the idea here is for people who come from another country to be able to combine those two things and move forward more quickly into working.
Nurse aides have been around for a long time, but in about 1985 they had to undergo a state certification, meaning they had to take a program, a certain number of hours in class and clinic, and have a state test. Home health aide at this point is more loosely defined. They don't yet have state certification for home health aides. It's up to the agencies. This is a commode. A commode is a portable toilet. I've been a nurse since 1985. I'm a registered nurse, and I have been with Holyoke Works since 2009, almost 9 years. It's been a real eye-opener, and it's helped educate me and help me to be more compassionate and change my teaching skills to meet a different level of learner, specifically someone who doesn't have English as their first language. For instance, thumbs in Spanish are not called thumbs. All of these are fingers.
I take this program because I like to help people, and also I have 2 kids. The little one have low muscle tone problems, and the other one is autistic.
People think that being a nurse aide might be an easy job, but it's actually a very difficult job. They work closely with the nurse, and they do a lot of the physical care. Nursing has changed over the last 30 years. I've had students in my class that are doctors and that are registered nurses from other countries, and they can't practice here. So they're starting at the beginning and working their way up. Some of my students speak 5 languages. And I tell them I'm in awe of them because I speak 1 language.
So all of the English language instruction is what we call contextualized and hands-on. It's all very relevant to the job that they will be doing. And as much as they can practice with real-life things and play out real-life kind of scenarios, the learning will be that much greater. They'll remember it much better.
I think being a nurse aide is a really difficult position. Physically, emotionally, mentally, spiritually. And I think the people who are trained as nurse aides and continue to provide heartfelt, compassionate care need to be honored more, because if I'm putting my mother or my father or my husband into a long-term care facility, I want to know that somebody's going to be spending a few extra minutes making sure they're really comfortable.
I'm gonna be more than happy to help others and to apply those skills that I'm gonna learn here after the program. And also, I'm gonna feel great if I see the progress and apply my skills in the clinic.
The length of the program allows for more concentration on compassionate care. Anyone who's been into a long-term care facility can see that there are problems in the medical industry. And I want my students to take care of people like they were taking care of their own loved ones, not some stranger on the street. And that may sound easier said than done, but it doesn't always come naturally.